Recently on Dr. Oz, it was stated that physicians have less than 1 hour of education on oral health. So how can we expect them to have any connection with oral health and their overall health? It's our job. What I've found is physicians now, if you can help them, they will love you for that. My wife's actually a little jealous because of my inner circle of physicians that are friends now. We do things all the time. I get invited to go golfing with them, we play racquetball, and when you start getting those circles in your life, they tend to be with other physicians, so you expand it and you become that part of it that's really good. I've even been invited to wine tastings. How much fun is that? So pursue those relationships. You can do that. You're helping them in the meantime. Start the relationship, form your inner circle, and expand your circle of influence in your area. I'm a dentist. I used to think that they had no interest in what I had to tell them. We are actually the oral health experts for them, and we're such a key part of their circle that they utilize. And physicians have always been good at that. If you're an ENT, you've got your group that you refer to, and that's who they hang out with. Different specialties really have their circle. You can be an important part of that, and it's great fun. And you really start this group of friends that is so much more than just the dry blah, blah, blah of writing letters and sending out things to these physicians that you'll never meet. That's where the rubber hits the road. The outcome of that is that we become habitual referrers to each other, and I can't wait to send patients that don't have an existing physician to these buddies of mine, and also the same thing goes for them. So it becomes a real build out of our relationship, and that's where some great things happen as far as expanding practices. And as always, I take my referrals very seriously. These are friends going to friends, and that's a great setup for care. And also the same thing goes when someone's referred to me and they've been given the trust that I am going to take care of them, they come to my practice in a much better state of mind and much more open to being helped rather than guarded and stepping back. And that's the juice of every day in a dental practice, is treating patients that want to be with you and not fight you. You are an important part of healthcare, and along with your inner circle of physicians, you will really have some not only improved care but great fun in your practice. This will alleviate a lot of the confusion, a lot of the miscommunication, and you really have an opportunity to help some people. And you'll find that you'll elevate yourself and your practice in the eyes of the physicians and the patients that you're treating. So I'd be anxious to hear what your experiences are in connecting with physicians. Please comment on the blog below.